survey agencies are really struggling with balancing state and federal workload priorities while trying to maintain a well-trained, effective workforce. Many states have seen an increased volume of survey and certification related work, and that has increased certainly their workload then. While the workload is increasing, there's no consistent mechanism for addressing the need for additional staff to complete the work, particularly when looking at the federal work. Furthermore, states typically can only add new positions with the approval of their state legislature. So even if the federal government increases funding for additional work, those dollars do not automatically translate into acquisition of new positions. Depending on how the money is dispersed from CMS, the state agency may not even be able to access the money until they're given state spending authority. So at the very best, there's typically a lag between increased funding and increased resources. The pandemic has created additional survey activities known as the focused infection control surveys that the state agencies must complete. These surveys typically have a very short turnaround, and the state surveyors often must return to the same facility for the same type survey within a matter of just a few weeks. Thankfully, CMS provided revised guidance in January of this year for completion of these surveys, which helps the state agencies manage the workload, but it is still new workload that must be completed and monitored by the state agency. Also, in June of last year, CMS issued guidance for COVID-19 survey activities, which included enhanced enforcement actions for noncompliance with infection control to provide greater accountability and consequence for failures to meet basic requirements. Preparation of these actions inevitably increase additional work for the state agencies, again, with no added resources. And of course, since the pandemic, most routine survey activity was paused, which has then resulted in an inherent backlog of survey work. So the state agencies must now develop what I refer to as a recovery plan to prioritize future survey work. From my experience, the greatest training challenge is finding the resources, including the time for training. Many states do not have a dedicated training staff. Therefore, training activities are often added to an already overflowing workload. Also, surveyor turnover results in training multiple people for the same task. States then often struggle with the necessary tools for their training staff. For instance, a training need can be identified, but the state agency doesn't have the staff with the technical background to effectively cover the material, or the technical staff simply are not equipped to provide the training. In other words, every great surveyor is not a great trainer. Also, training does not end with reviewing technical materials in a classroom setting. Effective training also includes a field component to ensure the surveyor translates the information that they've learned into the compliance decision in the survey process. All of these activities take time and resources to complete. State agents need a better handle on the data associated with the workload. Information that they need includes current workload requirements that are defined by CMS in the budget agreement, as well as the performance standards. The states also need to know what work needs to be done. Very important to know what is about to be overdue before it's overdue, since you can't unring the bell. And then they also need to know what work is already overdue, because that work should be prioritized, particularly depending on the survey history of that entity. Then the state needs to also be aware of survey scheduling considerations, such as coordinating surveyor qualifications with scheduling data. They need to know the history, as I mentioned earlier, because that will help them guide their decision as to how to prioritize the survey. They need to be aware of the date of the last survey to assist with the survey prioritization, and the facility location compared to the trained surveyor availability. Then complaints need to be combined with recertification surveys where that's appropriate to enhance efficiency, so that one visit can accomplish as much work as possible, which then also guides survey staffing, who needs to be involved based on the type of complaints that were filed and how many people need to be involved in that survey. HMS has a team of subject matter experts who are highly experienced state and federal survey and certification veterans that have a diverse background working directly with CMS and state agencies related to CMS policy, process implementation, as well as state licensure organizational structures. This incredible team has over 200 years combined experience in areas such as workload management. To date, HMS has provided hands-on technical assistance to 10 state agencies through state and federal contracts. This assistance has included coaching in workload management and survey scheduling. In our various roles with states, we've identified, for instance, challenges state survey agencies were experiencing in efficiently accessing data to assist in managing and reporting on workload and facilitating their compliance with applicable performance standards. So HMS developed an application that provides real-time metrics for state agency management. This application includes also a dashboard function for performance monitoring, and it enhances reports from multiple federal systems in a consolidated browser-based application. This allows staff to quickly view data entered into the CMS system applications, which assists the state agency in meeting state and federally mandated workload requirements related to the oversight of healthcare providers. This means that people that do not necessarily have a lot of experience in developing reports can still easily access reports from the data systems that is managed by CMS. HMS leverages all available resources to identify areas of concern in the state agency operation. HMS then utilizes a standardized approach to assess various areas of the state agency. We conduct a gap analysis to identify gaps between the current state and the future goal, and then develop a plan that comports to state and federal expectation to close those gaps. Through the technical assistance process, HMS provides support, documentations, and tools to assist with state agency operations improvement. HMS has an extensive library of resources, including training materials, tools to efficiently develop needed interventions while maintaining and adjusting resources as needed to meet the individual state's needs. My role at HMS has allowed me to effectively continue what I did for so many years as a state survey agency director by providing support and leadership to state agencies needing assistance. State agency responsibilities are broad and complex when managing multiple survey programs and balancing federal and state obligations. Changes in the regulatory environment, to the survey process, and in state licensure workload fluctuations, as well as state agency staff turnover, are some of the primary factors that stress state agency operations and may ultimately impact survey timeliness and quality. The COVID-19 pandemic has added another layer of complexity to state agency planning and management, as state agencies must now address additional survey backlogs, incorporate safeguards against the virus for staff and population served, and still continue daily operations. The technical assistance mission is to identify, analyze, and address operational challenges and provide a path towards performance improvement through activities such as coaching, training, assisting with the development of processes and procedures and other operational components. We fill a gap for state agencies needing support, particularly when new leadership is hired in a state and they have little understanding of the work they're taking on. I really wish we had been around when I was a new state director 20 years ago.